Hello, my topic is fecal microbiota transplantation for primary Clostridium difficile infections. First, what is microbiota? Are microorganisms that reside in a previously established environment. Human beings have clusters of bacteria in different parts of the body, such as in the surface of deep layers of skin, the mouth, vagina, and the gut. These are called flora or commensals. Here's a video about microbiota.
Antibiotics is it can kill the good bacteria that live in your colon. This can lead to a painful infection called C. diff colitis. Dr. Anthony Farilis highlights a therapy that can deliver almost immediate relief to people who are suffering with this colon infection.
We see patients that have been on rounds and rounds and rounds of expensive antibiotics for months, and they're not getting better. Then you are
Performed much like the colon.
onto the lining of your colon. The response is with basically outcompete.
Here's some examples about normal microbiota. In skin, Staphylococcus epidermidis, Micrococcus corynebacterium; in the eye, epidermidis; in the oral cavity, Streptococcus mutans, Streptococcus sanguis; in the respiratory tract, Epidermidis, corynebacterium aureus; in the gastrointestinal tract, Helicobacter pylori, Lactobacillus, Micrococcus, Clostridium, etc. What are the beneficial effects of normal microbiota flora? It synthesizes and excretes vitamin K. The normal flora prevents colonization by pathogens. The normal flora antagonize other bacteria and stimulate the development of certain tissues. Clostridium difficile is a gram-positive spore-forming anaerobic bacillus. Clostridium difficile illness usually develops during or within a few months after a course of antibiotics leading to suppression of the colon normal flora. It is associated with diarrhea and pseudomembranous colitis, toxic megacolon, sepsis, and death.
Number 6. Fecal microbiota transplantation.
Antibiotic therapy, used for medical treatment, is supposed to kill bacteria, but it can also increase the odds of some people developing a dangerous and potentially lethal infection from rod-shaped bacteria called Clostridium difficile, or C. diff. Infections from C. diff and the infectious diarrhea that it causes is a major reason for increased healthcare costs for hospitalized patients. Gut microbiota is the name given to the microbe population living in the human intestine. When antibiotics are used, aggressive and friendly bacteria in the gut are often killed together by the drugs, allowing for abnormal C. diff growth.
Fecal microbiota transplantation is the process of transplantation of fecal material containing bacteria and other antibacterials from a healthy individual into a recipient.
Treating Clostridium difficile with fecal microbiota, which is also known as the colon. In most cases, these microbes are harmless or even beneficial to a healthy individual. However, conditions that require treatment with antibiotics can kill off many of the good bacteria in the colon, allowing the bad bacteria, called Clostridium difficile, to take over. Toxins released by Clostridium difficile can damage the lining of the colon, a condition known as Clostridium difficile colitis. Clostridium difficile infection can lead to life-threatening complications, such as toxic megacolon, where the colon becomes dangerously enlarged. Clostridium difficile is normally treated with a course of antibiotics, but recurrent infection occurring between 20% to 60% of patients after an initial episode. The standard treatment for a recurrent infection is antibiotics, but in cases where this fails, there is a new alternative treatment. An emerging solution for patients with recurrent infection is fecal microbial transplantation, or FMT. Also known as stool transplantation, FMT restores good bacteria in the colon by using the good bacteria from a donor.
So, in conclusion, studies confirm the efficacy of FMT. Studies are needed to determine the safety of fecal microbiota transplantation may be safe and well tolerated, with few serious adverse events. Future FMT studies needed because evidence is insufficient about whether treatment effects vary by FMT donor, preparation, or delivery method. Thanks.